Good morning. Kemp Bottles in Philadelphia. Kind of wrap up our discussion of Medicare cuts, health care, and the American federal budget deficit problems. We've talked a lot about the need to decrease per capita cost and increase quality in order for us to transform the American healthcare system. We've talked about the Affordable Care Act and how it cuts quite a bit of money out of Medicare. We've talked about the budget ceiling deficit compromise, which means that January 1, 2012, we're either going to cut $1.5 trillion or $1.2 trillion out of the federal budget. And this means that Medicare is going to be cut. Where would you cut Medicare? Well, nobody knows. We've seen President Obama has proposed a budget. We don't know what's going on with the super committee because all of their negotiations have been in private. But it's pretty clear where one might cut by looking at congressional documents from past examinations of Medicare. So let's take a look. What's on the table? Medicare Part A. Well, you could cut graduate medical education, which would be $15 billion. So Medicare pays hospitals that have residents who are training to be physicians extra money because we know that resident physicians aren't as efficient as career physicians. So if you cut GME payments, it's $15 billion. We could remove the rural hospital add-ons. That would be $62 billion. If we do that, critical access hospitals in rural areas would not get extra payments out of Medicare. Well, if GME is unpopular with the American Association of Medical Colleges in New York City, places that have a lot of graduate medical education reimbursement for residents, then you know that Senators Harkin and Grassley of Iowa are not going to be too anxious for us to cut $62 billion with critical access hospital support. Well, what about post-acute care? We could have new home health copays. That would save $40 billion. We could increase the skilled nursing facility cost sharing. That would be $21 billion. Or we could freeze the post-acute care market basket, $14 billion. The problem is, no matter where you cut, someone's going to feel they're a loser and fight it politically. What about Medicare Part B and D? Well, lab test deductibles and copays. If you change those, $24 billion in savings. What about cutting down on unnecessary CT scans and MRIs? Prior authorization for imaging, $1.1 billion. You could reduce payments for drugs administered in doctors' offices. That would save $3.2 billion. You could establish a Part D rebate for dual eligibles and low-income subsidy recipients, $120 billion. That's a big one. You could recover payments to Medicare Advantage that are inefficient, $2.6 billion. You could increase the age of eligibility for Medicare from 65 to 67. That would save you almost $125 billion. You could freeze income thresholds for high-income patients and increase premium shares. That would save you $13.7 billion. You could impose an excise tax on Medigap patients for a savings of $53.4 billion. So you see that there's really no way to cut Medicare and do it in a way that's going to be politically popular. And yet we know we have to decrease per capita cost and increase quality. That's why it's going to be very interesting to see where the Medicare cuts come. But one thing I can tell you for sure, in the future, there's going to be less money for doctors, less money for hospitals, and all providers, hospitals and doctors, are going to have to decrease the amount of waste in their systems. They're going to have to use Lean or Six Sigma or some other methodology to become more efficient and cut waste out of their systems. So we're going to have to change the way that we deliver care so that we can cut the waste out of the system, so we can cut the federal budget deficit, so American companies can be competitive in a global marketplace. Well, that's it for this wrap-up of thrilling news about Medicare, cuts, and health care. Remember, you can follow me at my blog on www.kempbottlesmd.com or check me out on Twitter @KempBottles. Until next time, Kemp Bottles in Philadelphia.